Hi guys, hope you're all well. In this video, I'll discuss about Army Dental Code interview. As per the previous batches, previous candidates, these questions are made. So first, after entry, like all other interview, you will expect some introductory questions to ease or soothe with the environment. So what are the introductory questions the interviewer may ask? Like give your introduction, or tell us about yourself, or some personal questions. These are not actually any serious questions, it's very normal questions. Each and everybody can answer. So don't worry about the introduction. They will introduce with you. They though they have your biodata or your where you read, where you did your BDS, MDS, they know all from your record, but they will ask about your father, mother, or about yourself. They'll ask. After that, the second phase, they may ask some questions for your personality test. Here you have to score well, here you have to answer well. This is the not most vital part. The most vital part is the subject wise questions, dental subject questions, but this part, the personality test, is important. So, what are the model personality test questions they can ask? Like, why do you want to join Indian Army? They may ask. They may ask, why do you think you are fit for army? What are the qualities of army officer? I have made some videos. What are the questions they can ask other than dental subjects? And I have also made a video where I describe what are the qualities a army officer should have. They can ask this type of questions. And any situation based questions. Situation based means you are in a situation where your troops and you fighting with your enemy. You have to fight that time that maybe there is shortage of commanding officer, maybe shortage of troop, so you are doing fighting, and that time a patient in the middle of fight, in the middle of war, how you tackle the situation. Do you continue with your fighting part, or um, do you go for treat patient? Maybe this type of situation based questions. But in army dental core interview, the situation based questions are a rare chance of asking, so don't worry about that. Whatever you that time, whatever thinking came into your mind, just answer. And the other questions, like why do you want to join Indian Army, you should have prepared for this answer before you entering the hall. And you have to be honest that what is the original reason of joining of Indian Army. That maybe your financial condition, maybe you want to wear Indian Army uniform, you love and respect an army, or maybe your parents already in army. What are the reason, you have to just say. And my advice is you have to say honestly what is the true fact. And why do you think you are fit for army, you have to say. Actually, you have to say the qualities that an army officer should have. You have the qualities. What are the qualities? I have made a video, but I am repeating, like responsibility, loyalty, honesty, confidence. Different qualities are there that you have in you, and you are fit for army. So you have to answer like that. Next, the vital part. At the interview, there will be faculties from all the dental subjects. All the dental subjects means all the final year dental subjects. So you have to be very good in dental subjects. There are many questions you can expect from ortho, prostho, oral surgery, each and every subject of final year, and also medical subjects too. So if you prepare well for NEET examination, NEET PG examination, you have to revise the questions, the common questions, and you have to answer. This part is very vital. And how you have to prepare the final year subjects? There are so many subjects. You have already read in your final year. You have already read in your preparation time for NEET PG. So it is not difficult for you. So your preparation will be based on dental subjects, especially final year subjects. So you have to first note down what is the basic questions from the chapter I am reading. If you are reading, as for example, if you are reading local anesthesia chapter, the most common questions from local anesthesia is what is the composition of local anesthetic solution used in dentistry. So you have to know the composition. That is a must. Then what is the mechanism of action of local anesthesia? What is the classification? What are the complications uh, can happen from local anesthetic solution if you give? So these the common questions you have to know, must know. And the difficult questions, dose related, different systemic problems, so little complicated questions. If you don't know the complicated questions, no problem with that, but you have to at least know the basic questions. So you have to choose the basic questions from the chapter. As for example, if you are reading lichen planus, you don't have to go for the statistics, you don't have to go to epidemiology. Just why or lichen planus, what is the cause, what is the treatment, what is the clinical feature, histopathology, like common questions you have to read. Like if you are reading cyst, most common cysts that is related to dentistry, that is radicular cyst, lateral periodontal cyst, odontogenic keratocyst. These are the common cyst in the chapter of uh, odontogenic origin of cyst. So these questions you have to choose, you have to read and prepare well these questions. Like if you are reading the chapter of space infection, important space in dentistry, buccal space, canine space, and triomandibular space. So these questions, these spaces, boundaries, extents, and you have to you have to know. You don't have to know the parapharyngeal space, retropharyngeal space, but you have to know the common spaces that is related to dentistry. So the common questions you have to know. I have made a dental questions video. What are the common questions you can expect? You can go through the video. Yeah, this is important. Next, some basic medical chapters related to dentistry. You have to know some basic medical chapters like blood counts, normal blood counts. You have to thorough knowledge about the NSAIDs, local anesthesia, some amount of general anesthesia. Now, bleeding disorders. You have to have thorough knowledge about the bleeding disorders you may encounter during dental procedure. What you have to do, what are the measurements to stop bleeding, uh, what are the reasons of excessive bleeding during surgery. You have to thorough knowledge about this. Diabetes mellitus, what are the normal blood sugar level, how you treat, what are the precautions you have to take in diabetes patients before extraction, what are the uh, high blood sugar level when you have to stop extraction or minor surgery. You have to know all these things. You don't have to know what are the treatment of diabetes, but you have to know related to dentistry questions actually. Now, myocardial infraction. You don't have to know the pathophysiology of myocardial infections, but you have to know when a patient had suffered from myocardial infraction, what are the time lapse you need for extraction after MI. So these questions are important. And infections, infection control, infection the treatment part is also important. What are the antibiotic you can give, anaerobic infections, fungal infections, viral infections. So treatment part of infected disease are important. Streptococcus infection, staphylococcus infection, cellulitis, Ludwig's angina, these are important. Wound healing. So some basic questions you have to know, and some tricky questions, like not tricky questions, this is common questions, like a patient is epileptic patient, you are treating, what are the precautions you have to take? Diabetic, I have said already. Then a patient is suffering from hyperthyroidism, what are the precautions you have to take? What are the precautions you have to take uh, when you are treating a disabled patient, when you are treating a child patient? So this type of situation based question may ask. Or pregnant patient, what are the position in pregnant patient, when you have to do the surgeries or dental treatment in a pregnant woman? These are the common questions. Now after that, they may ask some GK questions, especially that is related to army. They can ask or not, but you have to be prepared for that. The model questions are: name of the commander in chief of army, name of chief of defense staffs, name of chief of army staff, name of chief of naval staff, air force staff, rank structures of Indian army. I have made a video about the rank structure of Indian army, you can watch this. The name of defense minister, name of health minister. So these are some model questions that is related to army, you have to know. And if you think the other GK that is related to army, you can prepare for those questions, as GK has no syllabus, but these are the importance. Next, current affairs. So current affairs is depend upon when you are giving interview, the 1 month or 2 month or 3 month back, what are the events, important event globally or nationally, you have some knowledge about that. But current affairs has no syllabus, you have to read newspaper, or you have to watch news every day for that. Some model questions, model current affairs, like coronavirus, Citizen Amendment Act, what is Assam Accord, Bodo Accord 2020. These are the model questions, but current affairs has no syllabus. So like that you have to prepare introductory part, then some personality test, some dental questions, some GK, some current affairs. So altogether it will gonna be a compact interview. So be prepared for that. Best of luck. Thank you very much.